Good afternoon. My name is Corina Herrera Loera, and I'm a Public Information Officer with the Santa Clara County Emergency Operations Center. Today we have another community forum. We have two guests. One you'll be meeting shortly, and the other a lot of you are already familiar with, and I'll be introducing them shortly. But before we go into our conversation, I'm going to do a brief update into our county and the most recent information regarding COVID and vaccines, and also particularly related to our youth. So if I can get the next slide. So an update as to our current numbers. Here you can see the different ethnicities breakdowns. I want to focus where it says cases by race and ethnicity. These are the numbers of cases of COVID in our county. And so the numbers that I want to highlight and want to continue to highlight is the Latinos are 25.8% of the Santa Clara County population and still make up over 50.3% of the cases. And so it's still very relevant. COVID is in our communities. And as you can see, these last numbers were updated on May 10th. Next slide, please. On this one, I want to highlight again, I did break it down per ethnicity. And you will see in percentage-wise, all these numbers and all this information you can access via our website, which you'll see on the bottom of our screen. But I did break it down in regards to the current percentages, and these numbers were last updated May 11th. And so obviously there you can see the African American are 54% of those that have been vaccinated. The American Indian is 128%. And our Asian community, 90%. Our Hispanic Latino community, unfortunately, continues to be lower, and the lowest, 49%. And the Native Hawaiian, 121%. And those numbers that you see a little bit, obviously more than 100%, is because, some the population rate is based on the census, and then those that mark in that category will obviously put that number higher. And so still high numbers, which is great. That's what we want to see, 100% or more, of course. And then on the white, 59% of the white community. So again, I want to highlight that our Hispanic Latino community, not only do they make the highest cases for COVID, continue to make, but unfortunately, we continue to be the lowest vaccinated in our community. Under 50% of our community is vaccinated still. Next slide, please. And then we have similar trends for the youth in East San Jose and South County. Here you see, this is a percentage of Santa Clara County residents ages 16 to 49 with at least one dose of vaccine by county regions. And so between December 15th and May 2nd. And here you will see the different areas in our county. But the highlighted areas that I want to focus on here is, again, our South County, 53.3% have received at least one dose. And then in East San Jose, only 54.1%. All the other counties, or I'm sorry, all the other areas in our county, as you can see in the light blue, are 60% or higher. We even have Los Gatos, Saratoga, Monte Sereno coming in at 84.9%. And so this is just the numbers of those that are receiving that have at least one vaccine, one dose, ages 16 to 49. So again, highlighting that our South County and East San Jose continues to be lower. Next slide, please. And then this slide breaks down our 16 to 17-year-olds in our county who've been vaccinated, and then breaks it down to our females and our males. And so again, I want to highlight here that only 20.1% of our females and only 17.3% of our males, Hispanic and Latino males and females, have been vaccinated. in our county. And so, compared to the other ones, so we have African American, we have Asian, we have white. Again, our youth also follow those trends. The numbers are the lowest in our Hispanic and Latino communities. Next slide, please. And so, again, all individuals currently ages 16 and older who live, work, and attend school in our county are currently eligible for a vaccine. And as a lot of you probably have heard, our 12-year-olds and older will be able to get vaccinated in our county soon as well. We are working on the details in regards to the timing. Looks like there was an approval a couple of hours ago on behalf of the state. And so just working on the details now to open up vaccines in our county. So just know that that will be opening up soon for our 12-year-olds as well. And just a reminder, visit scfreevax.org or call 211 to schedule those appointments. And we also have drop-in centers. And so we can go to the next slide. If we can go to the next slide. And in regards to the drop-in centers, these centers are open and available for you to come in and drop in. You don't need a appointment. So we have the fairgrounds, Expo Hall, from 8:30 to 4 o'clock on Thursdays and 8:30 to 8 o'clock tonight. So I left it there because it will be open tonight till 8 p.m. So after this community forum, if you haven't gotten it yet, please head over there. We have Eastridge Mall, Wednesday through Saturday, also 11 to 6. So still open tonight up until 6 o'clock. Emmanuel Baptist Church, that's Wednesday through Friday, 8:45 to 6 p.m. Also tonight, if you're listening in, head over there. The Mexican Heritage Plaza is only on Wednesdays. Well, they have a couple of dates, but I left this one for this week. It will be tonight. If once we're done here, or even if you're listening in on your phone, head over to the plaza. You can drop in and get a vaccine there. Next slide, please. And then also we have Gilroy High School, Wednesday through Friday, 8:30 a.m. to 3:30 p.m. Overfelt High School, Thursday, so tomorrow you can go between 9 a.m. and 4 p.m. and Friday between 11 a.m. and 6 p.m. And then Valley Health Center of East Valley, and that's Wednesday through Friday, 8:45 to 4 p.m. And just to let you all know, if you go to scfreevax.org, you will see a more extensive list throughout the county. These sites, I focused more around the areas of the least vaccinated folks out there. And so on scfreevax.org, you will see a long list of all the other sites that are open in our counties. And they do change as we go. Some of them are pretty consistent, but we also add more throughout the weeks, just looking at where our needs are. And opening up more sites as we go. And then in regards to the phone number, the 970-299, that's also a number where you can call and ask any questions regarding vaccines if you're seeing this later. If I can go, we can go to the next slide, please. And then just a reminder, youth who are fully vaccinated, can obviously participate in some of these events with less worry, also for us as parents. Events like family events, prom, sports events, graduation events. We know there's a lot of graduation events coming up. Go to work and spend time with friends, hang out and do the fun things that our youth like to do. And so it's safest, obviously, when everyone is vaccinated. Next slide, please. And so, again, just a reminder to follow these core principles, to continue to stay safe, get vaccinated now that we're opening up more and more, and most of us are now eligible to get vaccinated. Get your appointment or show up to any one of these sites. Stay masked. Continue to use your face mask. And if you go to the CDC website, I have a picture here where it will show those who are vaccinated, where they're able to, just not wear the mask and things like that. So that was on the CDC website. You're more than welcome to also go there for information, but continue to maintain at least 6 feet distance from others. Avoid crowds, stay outdoors, especially now that the weather is a lot nicer. It's easier to stay outdoors, and then get tested, especially if you are a frontline worker or exposed to the public. So continue to get tested, and you can go to our website here in our county, www.sccfreetest.org, to find places to get tested. Next slide, please. And then in regards to our call center, you can call 211 or 970-299 970-2999. And so you could also, as I mentioned, the 211. So the 211 is a general number. There you can call about, rental assistance, about the testing, about any general question that you might have, and you'll get directed to the appropriate department in person. The 970-2999, there you can get more specific information and help regarding the vaccines. And so there are certain nights where we have phone banking throughout the week. Next week, we plan to have one in Spanish. We've had Vietnamese. And so we try to have various languages so that we can assist our community in helping. And so, but that doesn't mean that you can't call throughout. We always have staff available to throughout the day to help answer your questions. And then if you prefer to text, you can always text your question to COVID-19. So text COVID-19 to 211-211, and then you can also communicate via texting. Next slide, please. Thank you so much. And so that was our presentation. Now I'm going to open it up to our special appearance. We unfortunately, our youth wasn't able to make it to our Wednesday time here, the time frame that we have for our community forum. So we pre-recorded his interview, and currently today he's at a football practice that he only has once a week, and football is his life, part of his life to him. And so missing his 1 day a week practice would be a lot. So we were able to pre-record and also visit the Levi Stadium. So I'm gonna go ahead and pass it over to our to Quetzal, who's helping cue that up for us so that we can see the interview, and then I'll go ahead and take it back on after that. Quetzal,
here today at the Levi Stadium here in Santa Clara. We have our guest here today, Alejandro, who's going to tell you a little bit more about himself. But we really wanted to take the time to hear from our youth here in our county. So without further ado, Alejandro, if you can tell us a little bit about yourself, what you do. Do you go to school? And what you do for fun, or any hobbies you might have?
Yeah, so my name's Alejandro Martinez Loera. I'm currently a student at De Anza College in Cupertino. I am studying business administration, and I am also a part of their football team.
Nice. So let's start off with the vaccine. Obviously, we're in the time where we're trying to get all of our county residents vaccinated, and so especially now our youth, since it's opened up to our youth. Are you vaccinated yet? Have you gotten your vaccine?
Yes, I got both of them already.
You got both of them, and which one did you get?
I got the Pfizer vaccine.
Pfizer. And when you got it, was it because you wanted to, or did your parents say you have to, or why did you get vaccinated? Why did you choose to get vaccinated?
To be honest, I think there's a long list of reasons why I got vaccinated. But atop that list, I'd probably say it's because mainly family. I think, especially my family, we're big into big dinners with everybody there, and I think that's really taken this pandemic is really taking that away. And in order to get back to that, I think it's more of a selfless act. We're trying to make sure my aunts, my elders are comfortable enough to where that if we are vaccinated, we could get back to those family dinners and stuff like that.
Nice. And in regards to, you said you got Pfizer, you got both. How did you feel when you got it? Like, was it different the first time and the second time? Did it hurt? Did you have any reactions to it?
Yeah, so I mean, the actual shot itself was very, very painless. It was very quick. In terms of like afterwards, there was some soreness in my arm, maybe a little bit of fatigue. But other than that, I felt pretty fine. I didn't have too many bad aftermath.
Okay. And in your family, are most vaccinated or all vaccinated?
Yeah, so all my family's pretty much vaccinated so far. Maybe just a couple that aren't, or that have only gotten one shot.
Okay. And was it easy? Like, did you get an appointment right away? Did you go in? Did you get in and out? Like, or was it like, did you take a long time?
It was super easy. I pretty much showed up on time to my appointment. Within 15 minutes, I was in and out, and on my way home. Yeah.
Okay. And then I'm hearing that some youth are, not getting it, or they're kind of hesitant. What would you tell, youth like that? Or first, let me ask you, why do you think youth are hesitant from getting their vaccine?
To be honest, I think youth are hesitant because they think that, or I think it is true, we do have a better immune system, and they think that, we could fight off the, COVID if we do get it and stuff like that, which is, it could be true and stuff like, whatever they say, but like I said, I think it's more of a selfless act more than, for your own good. I want to make sure everyone else feels comfortable. I'm sure if I did get COVID and stuff like that, I could, my immune system could fight it off compared to someone who's older. But yeah, I think that's why they don't get vaccinated.
And then, so now, like I asked earlier, or adding to that, the youth that are hesitant, or even parents, do you have a message for them or something, if they're still like on the fence, like, I don't know, and they hear this from you, something you want to tell them about, why they should get vaccinated, or, encourage them to come out to get vaccinated?
Yeah, I mean, first of all, it's a pretty easy process. I mean, here at Levi Stadium, you can come today and tomorrow. And like I said, I'm just going to reiterate that it's more of a selfless act more than it is about yourself. I think to make others feel comfortable in order to, get back into, we'll never get back to how it was before pandemic, but to get close, I think that we do need to get fully vaccinated.
Nice. And can you tell us a little bit more about, you mentioned today and tomorrow here at the Levi Stadium, what youth can maybe expect to get, or?
Oh yeah, I think at 5:30, 7:30, right? From today and tomorrow, youth are gifted some 49er swag along with. What is that?
So they, my understanding is, so tonight and tomorrow, 5:30, 7:30, like you said, 49er swag, and then we'll also have the tours around the NFL locker room. That you're not going to be able to do. So
and gift cards.
And gift cards to Chipotle and Starbucks. That's right. So all kinds of cool stuff. Cool to be out here too, to see where the Niners play, and experience, this place, pretty magical out here, and beautiful. And then, being able to come hang out with other youth too. I hear there's going to be DJ set up. And I know, we haven't been able to do much of that hanging out, right?
Exactly.
So just come out, check it out, 5:30, 7:30 tonight, tomorrow. You heard Alejandro, he got both vaccines, or, he had the first shot, second shot, and he's fine. You're playing football already?
Playing football, yep. Actually got practice
Feeling
tomorrow.
Good?
Yep.
Strong?
Feeling all right, yeah.
Nice, good. All right, well, come out, and thank you again, Alejandro, and we'll see you tonight and tomorrow night.
Thank you.
Great. So that was Alejandro Martinez Loera. We hope he's out there practicing for his football game, doing great. And as he mentioned, tonight's event at the Levi Stadium, for those of you who didn't take down the information, it is still tonight and tomorrow. It will be 5:30 to 7:30. Go to the green lot, number 1, park there. You'll see the sign, easy to enter. There will be, as he mentioned, swag gear from 49ers. The first 100 youth to go out will get a free gift card to Starbucks or Chipotle. Also, NFL tour of the locker room there, and DJ set up. So come out, family. It's for our youth, obviously, but our entire family. The entire families can come out and get vaccinated, and also hang out there at the Levi Stadium tonight and tomorrow night. And then tomorrow, tonight also, as you see the dates here. So tonight, tomorrow, and Friday. Tonight, May 12th, and then Thursday, May 27th, Friday, May 21st. There will be events over in Gilroy for the youth out there. For those that are getting vaccinated, there's free boba. Come out, bring your friends. Please share it with your community. You can access these flyers on our Facebook. If you scroll down to the flyers, you will be able to see them. If you can share them to your communities and get our youth out there to get vaccinated, would greatly appreciate it. So thank you so much again. And now I will bring in our guest, Mr. Dr. Solorio Cortez. Gerardo, welcome back. And as many of you know, Mr. Dr. Gerardo Solorio Cortez is our doctor that has been with us on a once a month at least, and he serves the community in Gilroy, is a doctor there, and he'll maybe, if you can tell us a little bit about yourself, and then also any current updates for our county, Dr. Solorio Cortez.
Yeah, thank you again, Karina. I'm very happy to be here. Inviting me again, and it's always a pleasure to be here and talking to our community and informing them of the updates that are happening with COVID and the vaccination front. So today, let me a little bit about myself. I mentioned this before. I'm a doctor in Gilroy, primary care, internal medicine, and I'm also one of the doctors that vaccinates people at our site. At the Gilroy High School through Santa Clara County. And today, I think, we're very excited, this presentation, what you've talked, and also...
Oh no, we froze.
I'm back, right?
You're back,
Yeah.
yes.
So the CDC has, we're very excited that the CDC has approved the vaccination Pfizer for children from the ages of 12 to 15 a few hours ago. So FDA had approved it yesterday, and now the CDC with their advisory board has given it the okay. And now it's going to be up to the states, counties to take that approval and then go ahead and start that process in their own site. So as you mentioned, keep your information handy, and soon you'll know that you'll know when you'll be able to get the vaccine for your children. Again, ages from 12 to 15 years old. Alejandro already touched upon all the good themes that I would want to convey to the youth and our community, and that one being is that it's great that we've since we started all this process back in December. We started vaccinating the most vulnerable population that was getting affected by, COVID, which is the elderly, people in nursing facilities, people with other medical conditions, comorbid conditions, we call it in our jargon. And then we started doing the adult population, and now we're left with our adolescents. And to give you some data is, our population in the United States is 330 million people, and of them 20% is children. So it's a big chunk. So that's the data. And then when it comes specifically with the COVID related data as it relates to children, we know that the cases are not as high as someone being older or someone having medical conditions, but the data says that there were 1.5 million cases of COVID, symptomatic COVID, with the ages of 12 to 17. And within those cases, there were 13,000 hospitalizations. So that gives us more reason of why we want to, vaccinate this population. First of all, of course, for the health of this population, but also when it comes to herd immunity and helping the community, that's another reason why we want to vaccinate. Now, again, the data, the approval has been for Pfizer. The process is going to be very similar to what's in place now. So it's going to be vaccine given the first day, and then 3 weeks later, you'll get this your second vaccine. Very interestingly, in the studies that were done with the children, there were no severe allergies like anaphylaxis, like it occurred when on the other studies for the older population. So that's very, very, very good news. The study that was done, it wasn't when it comes to the amount of participants, wasn't as big as the adult studies. With the adults on Pfizer, Moderna, we were talking about 40,000 total participants. In this study, the ones that was used by the FDA and CDC to come to their conclusion today, there were a total of about 2,300 participants. In the arm that got the vaccine, there were 1,000 children, and in the arm that didn't get the vaccine, there were another 1,000 children. The also very good news is that that arm that did get the vaccine, it was 100% efficacy in preventing any symptomatic disease, coronavirus. So it's 100% versus the ones that didn't get vaccinated. There were some cases of coronavirus within that population. So that's why the CDC, FDA saw this awesome data. Also the safety of the studies, or the safety of the actual study. They were very similar to the adult when it comes to, as Alejandro mentioned, is the video, maybe some arm pain, fever, headaches, but very similar to the adult studies. So, and that's why we got the green light. So we are very excited here as fellow physicians, healthcare providers, the state, the county, the United States. We're all very happy that this got approved, so that we're able to get back to normalcy. So this is excellent news. And as we've been saying in previous Facebook presentations, is as soon as you hear that you're eligible for your vaccine, please sign up. Thank you.
Great update. Thank you, Dr. Gerardo Solorio Cortez. And I want to go ahead and head over to the questions that we have from our community and comments. We'll go ahead and start with Mr. Greg Gant, who mentioned no vaccine mandates, please. Thank you, Mr. Gant, for tuning in. We have Marimar, who is asking, where will people be getting the COVID vaccine for teens, is what I'm assuming. And so good question, Marimar. I know it was before we put out the information, but I'll go ahead and repeat it. They can go to any one of our sites that we have here in our county. But we have some specific youth events coming up. And so one of them is tonight and tomorrow night at the Levi Stadium, 5:30 to 7:30. You can show up. The first 100 youth will get, a gift card. And then we have tours of the locker rooms. There's going to be DJs. So the whole family can come and get their vaccine tonight there at Levi Stadium, and tomorrow night, 5:30 to 7:30. And then in Gilroy, we're also going to have events in Gilroy specific to the youth. And so those flyers and the dates are on our website. But you can go to any one of our sites any day. There are some that are drop-in that you can just show up. But you can start making your appointments now for the eligible youth 16 and over. We have Leanne Tanner, who says, thank you for all the updates. Thank you, Leanne, for tuning in. And we also have Cam MK. Can youth 12 and older go to the youth events tonight at Levi Stadium? So there's good news, and I don't know if it's not so good news. So yes, the good news is yes, they can come. Bring the entire family. And the maybe not so good news yet is that we still cannot vaccinate our 12-year-olds. We're waiting for the approval and the green light. Want to make sure that everything, it's checked and is clear for 12-year-olds to get vaccinated in our county. So yes, they can come. And who knows, as of tomorrow, we may open it up
Right.
for the 12-year-olds. We don't know,
Right.
but it will be coming soon, as you heard Dr. Solorio Cortez also mention. And then we have Jose Luis. Jose Luis says, 12-year-old, when are available. So I think Jose Luis is asking the same thing about when they're able to get their vaccine. Again, that should be coming very soon. And then we have Mini Aguja. When can 12 to 15-year-olds get vaccinated and where? Very good questions. I know we all want our children to
You know
be
what,
safe.
Karina, I'll chime in and just say,
Please.
thank you for these comments. Thank you for the energy. Thank you for the interest. It goes to show you that, we all, want to, help our, condition, protect ourselves from this horrible disease. And I love the excitement. And then for us, Karina and I, our bosses are, who hopefully maybe pretty soon, maybe this weekend, we'll be able to, start doing this and, getting the ball rolling so that we get our 20 and 15-year-olds vaccinated. So thank you.
Absolutely. Thank you. And I just want to also remind our community that we are having a community forum tonight or later today from 4 to 5 in Spanish. So if you know anybody that speaks Spanish or would like to tune in Spanish, ask any questions in Spanish. We are going to have also Dr. Gerardo Solorio Cortez there. If you know anybody, please let them know to tune in to our Spanish community forum if that is their language of choice as well. Just reminding our community. And I don't see any other questions. Community, I'm going to, give you a couple minutes here to get your questions in. We have Dr. Gerardo Solorio Cortez here, doctor that's available to answer any one of your questions regarding to vaccines today. If you have any doubts, if you have maybe an uncle, an auntie that still doesn't want to get vaccinated, and you might have specific questions as to how you can help them make up their mind, and support them, or maybe get them a ride to get a vaccination. Please post your questions here. We are here to answer. So any other questions that anybody has, feel free to put them there. I'm going to pass the word over to Dr. Gerardo Solorio Cortez. Any final thoughts, any final words for our community, Doctor?
I think, now we're at the point where, the word hesitancy and also just the hesitation of the vaccine and, people waiting or trying to see what's going to happen with side effects and such. And we just want to reiterate, we've, given, millions of vaccines now. We have an excellent system to report any, adverse events. Our county is doing tremendous and, opening up pop-up clinics, making it very easy, people for people to walk in, make their appointments. Our doctors, our healthcare providers, nurses, we're here to, answer questions that people may have. And, we understand the hesitation of individuals. And we just, want to let you all know that we're here to answer those questions that you may have and to get you, that vaccine. Thank you.
Thank you. And I just want to add that, as Dr. Solorio Cortez mentioned, we have a lot of sites and we have a lot of pop-ups. We have big sites such as the fairgrounds, the Levi Stadium, but also those of us, those of you that are waiting or that don't know, those bigger sites, might start closing down, or some of these sites are closer to our homes, or that make it easier for some of us to maybe go during our lunchtime or right after work or on our way to work. And so, if you're thinking about it, if you're like waiting a little bit more, we're in the process of starting to, look at which sites are going to be closing down, because again, as you saw our numbers, we got a lot of our community vaccinated now. Again, unfortunately, our community, the Hispanic Latino community, have the lowest numbers. So I just want to encourage our community to all get vaccinated right now that it's easy for us. There's transportation if you need transportation. If you haven't found a way yet to get vaccinated and you're just waiting, it's there. You let us know, put it on the chat, on the notes. We've helped several people in the past. Another community forums, get their appointment that same evening. We're here to support you. And so right now it's a little easier. Later might not be that easier. It might be a site that's maybe further away from your home, further away from work, maybe where you might have to wait a little longer because there's a longer line. Right now is the time to get vaccinated, the easiest time, I would say, because once those, again, centers might start closing down, we might have less staff available to support and then more lines and things like that. So get out there. The vaccine's waiting for you to come in your arm. And we have Andrea Curri, who says, or is asking, what percentage of the 12 to 15-year-olds do we need to vaccinate to help reach herd immunity? Do you know that, Doctor?
Yeah, that's a very good question. I don't know specifically when it comes to the age group, but I do know in general, the numbers initially when back in January with Dr. Fauci thinking about, or putting a number of what was the aim. And I remember back then it was at 65, 70%. That was the number being thrown around that would, classify as herd immunity. Now we're looking at 80%. If you look at the recent commentaries from Dr. Fauci and also scientists, so I would equate a similar number for this age group, because you want to take it in totality. And I think as you were talking, Corina, one thing that I did want to kind of expand on is this notion of variants, and as it relates also to herd immunity, is one of the reasons why you want to vaccinate is to not give the opportunity for that virus to mutate or have variation, as we're calling them. And the only way that's going to happen is if that virus has that opportunity. So how do you prevent that opportunity? Number one is the actual innate infection, which is not something that we promote. It's the vaccinations, the vaccines. Is by us being vaccinated, and moreover reaching the herd immunity of 70-80%, it lessens the possibility of any type of variation, mutation, going on with the whatever coronavirus is present now. So very good question. But I would say the clear answer is similar to what's the global percentage, which is 70-80% that we're looking at right now.
Thank you. Thank you for explaining it in a way that's easy to understand. We have Kamaljeet Singh, who just joined us and is asking, do we need appointment for kids? And so the answer is there are sites where you don't need appointments. Now, kids, I consider 16-year-old kids still, but some might not are young. We are not open yet for the 12 to 15-year-olds. So as of here in this county, as of right now, we're only taking in the 16 and older. You can make an appointment. You can show up to some of our drop-in sites. So again, I'm going to reiterate tonight at Levi Stadium, 5:30 to 7:30 tonight, Wednesday and Thursday. Here's a flyer. You can show up with your children, any youth ages 16 and older, and any younger kids. You can bring your entire family, but we're not vaccinating the younger ones yet. And so you can also get your vaccine. That will be tonight and tomorrow. That is a drop-in. You don't have to make an appointment tonight and tomorrow. And there's other sites. If you go to the sccfreevax.org, and there will be a list of all the other sites within our county that you can show up to that is just drop-in, that you don't need an appointment. And if it's easier to make an appointment, then you can call any one of these numbers, the 970-2999 or 211, and make an appointment. You can also make your appointment on sccfreevax.org. So we have everything covered. Those who want to just show up and get it, and those who want and need an appointment before, please go and get vaccinated. Again, our county is vaccinating those 16 and over who work, live, play, are here in Santa Clara County. And then soon we will be opening it up to the 12 and over.
Corina,
Yes.
I'll chime in just because I actually work in vaccine sites. So when we have 16-year-olds now, there's a parent signature form that needs to be signed for consent. But if that individual doesn't have that signature, we could do a verbal through the phone. So basically, again, going back to what the county is doing is, we're making it as, of course, safe as possible, but easy as possible, even, for our 16-year-olds. So you could basically, do your form, sign it, have your adult person that's responsible for you to sign it, number one, or you could walk into Gilroy and we could do a verbal by your phone, and we're able to document all that, because that's actually what we do in Gilroy and all these other county sites. So
Nice.
come.
Yes, thank you. And Dr. Solorio Cortez, we have Christine von Reisfeld here, who I'm going to read her comment, and then I think it's doctor related here. I'm involved in a clinical study as a chronic patient receiving immunosuppressant infusions with Johns Hopkins after 2 doses of the Moderna vaccine, and I have not developed antibodies. I've been advised to take another dose and to continue wearing a mask. Can you please remind some of the high-risk population we may be at risk for not developing antibody to previously named vigilance until studies are complete? Individuals can still participate in the study by going to vaccine response.
You
Any
said,
thoughts?
thank you so much, Christine. That was actually going to be one of my talking points, and I forgot it, or I omitted it, but it's true. It's we have to understand that some people are going to be vulnerable because of the conditions, medical conditions they may have, or the medications they're taking, or, as you're saying, the study you participated in. And they're, even after getting the vaccine, they're going to have the response. So what is a way that we're going to be able to protect that population is also by being getting vaccinated. And in this case, what I wanted to convey is that it's important for us to have the children vaccinated too, because they could also transmit disease, and one of the populations that could transmit it to is vulnerable populations that are suffering from immunosuppressant conditions. So excellent point. Thank you so much.
Yes, thank you so much, Christine. Thank you so much to everybody who joined us here today. Dr. Solorio Cortez, if there's any last thoughts or any last things that maybe you might remember, or you want to close us out with today here in our community, any last thoughts?
No, super excited. Pretty much, for going back to the children, as soon as you hear from us that you're able to get vaccinated, please get vaccinated. Keep your eyes open. That's what I'm trying to say. Keep your eyes open, and your emails and everything open for to get the green light from us specifically. Thank you.
Awesome. Okay, thank you. And talking about children, we have a last question here. Do children need to bring their immunization card or student ID? So I'll leave that to the doctor. I know you're at the site.
We haven't asked for immunization card. Student ID, if you have it, thank you. But it's mainly a verbal who you are. But yeah, I think an ID, if you have any form of ID, would be helpful. Definitely.
Yes.
If you have it, bring it.
Thank you. And the only thing I'll add to that is our parents. So once we open up, especially the 12 to 15-year-olds, so any 12 to 18, we do need the parents' permission. If you make an appointment, show up with them. That would be the best. Otherwise, something in writing, and or if it comes down to it, they may give you a call. And so just be ready for that. So always nice to just check it off before. Either show up with them, write a little note, letting them know that you're okay. So as soon as we open up the 12 to 15-year-olds, all of that population will need the parents' permission to get this vaccine. So with that, thank you again, Dr. Solorio Cortez. Thank you, community, for tuning in. You can watch this later. You can send this, to somebody if you think this would be important for somebody else to watch. I see here another Christine again, Vaughn. I'm the first patient my doctor at Stanford has seen with this response, but happy to keep trying. Get vaccinated and stay vigilant. Some of us are still vulnerable. I love that, Christine. Thank you. And that is a great note to end on. I appreciate all of you doing, your part so that we can continue to open up as we all want our state, our county, and go back to our everyday lives as we had prior to the pandemic. Have a great 2 weeks, everyone, and we'll see you again in 2 weeks with another topic. I see a couple of messages here before we close up. Sarah, this is what we do when we're live, right? I just want to make sure that we're able to answer as many. When can 12-year-olds start to make appointments? Awesome. I can tell she just joined us. Reminder. So when can 12-year-olds to 15-year-olds, as soon as we open that up? We don't have it open yet. We are waiting for clearance. So again, we want to make sure that everything is okay for our 12 to 15-year-olds to start receiving their vaccine in our county. And so it'll be soon. It could be even as soon as tomorrow, but not yet. You just stay tuned. Stay tuned on our Santa Clara County Public Health page here on Facebook. If you're connected on Instagram, we will make sure to put that announcement as soon as that opens up. So thank you all again. Have a good evening and take care. Go get your vaccine if you haven't yet. Good night.
Bye. Take care.